Good afternoon and welcome to today's webinar hosted by Current Consulting Group and Recovery Track. I'm Jessica Polk of the Current Consulting Group, and I'll be conducting today's presentation entitled Current Compliance Q&A Webinar, How to Start and Successfully Manage a COVID Testing and Vaccine Program. Today's presenters are Kirk Caesarly from Recovery Track and Bill Current from the Current Consulting Group. Kirk is the Chief Executive Officer at Recovery Track. He has 20 years of experience and has proven excellence in information technology and technical management. His extensive experience serving the federal, state, local governments, and healthcare industries has put him in a prime position for today's topic. He has numerous successful testing programs and proprietary applications under his belt. Kirk has perfected his ability to customize and design solutions for each and every customer. Bill Current is the author of Why Drug Testing, Updated and Expanded for 2020, as well as 9 other books on substance abuse-related issues. He founded the Current Consulting Group in 1998, and it has become the #1 recognized brand name in compliance, business development, and operations consulting in the drug testing industry. He created Current Compliance, the most up-to-date and comprehensive online subscription database on all state laws related to workplace drug testing, including marijuana and workers' compensation law. And with that, we'll go ahead and turn the virtual microphone over to Bill to get us started on this Q&A webinar.
Well, thank you very much, Jessica, and welcome everyone to today's presentation. You know, Kirk and I were talking about a half an hour ago about the topic and getting ready for it, and we both commented how, you know, a year and a half ago, thereabouts, you know, none of us knew anything about COVID, and we all sort of became experts very quickly to the extent possible. And we also commented that things are changing, and they constantly are changing, and we're responding to, you know, updates of information provided by the federal government, state requirements, etc. And then, you know, within a short period of time, we're responding to something different. So it's a constant changing topic. And we're going to talk about some very recent developments when it comes to COVID and its impact on the workplace, particularly mandated COVID testing and vaccinations and things of that nature. But we're going to do it from a very practical standpoint. So we invite you to ask any questions. As I mentioned, 18 months ago, we didn't know anything about COVID. And in the time that Current Consulting Group has been offering information and providing Q&A webinars for our clients on this topic, one of the most knowledgeable people that I've had the pleasure of working with is Kirk Caesarly, who stays on top of lots of issues from a sort of a technical management standpoint, but also from sort of the practical day-to-day aspects of it, especially as it applies to the workplace and how employers can deal with sort of the ever-evolving, ever-changing landscape of this issue. Now, we put COVID forever at the top with the question mark. It just seems like it's not going away. It's, you know, there are variants that are coming and other ones that are being, you know, on the radar in other countries, and there are breakthrough infections. You know, just yesterday, I think it was, we got the very sad news of the death of Colin Powell, who was fully vaccinated, but who had other health issues, of course, and he was in his 80s. But nonetheless, there are breakthrough infections that are affecting people. The good news is that positivity rates, hospitalizations, things of that nature are going down. So we're sort of we're in another one of those periods of time in which most of the news is good, but we've also got some very stringent mandates back in place. There's mask wearing, social distancing requirements if you go to Target or Walmart, etc. And employers are affected by these things because, you know, we've got more employees coming back into the workplace, people working from home, and yet we've got these requirements. You know, can employers require employees to be vaccinated? You know, we've got the requirements from the federal government that we're seeing out there for companies with 100 or more employees, right? As I'm going to show you 3 slides here that sort of show this evolution from a calendaring standpoint. But what about companies with fewer than 100 employees, and what are the best practices and safe practices for dealing with COVID, regardless of the size of your company. So on September 9th, the Biden administration came out with something called Path Out of the Pandemic, and it requires vaccines for employees working in larger companies, 100 or more employees in a company, as well as mandated vaccines for employees of federal government agencies, contractors with the federal government, as well as healthcare industry entities. And so a lot of responsibility for this has been pushed onto OSHA, and OSHA's developing the process by which they're going to be monitoring this and requiring employers to report in. And it's getting complex. I mean, we haven't even started it yet in for the most part, and it's very complex. A lot of information is going to be required of employers to gather and then possibly to report on a regular basis in terms of whether employees are fully vaccinated or whether they qualify for some exemption from the mandated vaccinations, and then weekly COVID testing of those who aren't vaccinated. And so a lot going on in that area. How we're going to manage all of that flow of information. On the 24th, if you look there in the first bullet, the Safer Federal Workforce Task Force released guidance for federal contractors and subcontractors when it comes to the mandated vaccinations. And let me go back to that slide for a second. And the reason why I put this on there is because, as is the case so often, things may be mandated or required within federal government agencies or for federal contractors initially, and then it kind of spreads to the private sector after that, or it becomes sort of the blueprint for how the private sector that's not mandated under federal contractors, how they deal with issues. And we see that with workplace drug testing, workplace alcohol testing, et cetera. I did want to share this quote though. This came out December 8th. Or excuse me, that workers are required to be vaccinated by December 8th. It says, after that date, all covered contractor employees must be fully vaccinated by the first day of the period of performance on a newly awarded covered contract and by the first day of the period of performance on an exercise option or extended or renewed contract when the clause has been incorporated into the covered contract. And so, you know, that's typical of sort of government speak there, but it also speaks to the fact, and the reason I like this quote here is because it's sort of in one quick paragraph, it sort of captures the complexity of all of this in terms of how we're going to possibly keep up with these requirements. Some people are asking about HIPAA privacy rules and are there violations of the HIPAA privacy rules when it comes to gathering information about people's vaccination state or whether they're getting tested, et cetera. If you look at the third bullet, the guidance that's come out from the HIPAA COVID-19 vaccination and workplace guidance basically reiterates that the HIPAA privacy rule does not apply to employers or employment records as it relates to this mandated testing, mandated vaccinations, and the required record keeping of all of that. You're going to get these slides. You can have them. I'm not going to speak to this one. I just put these on here so you could actually go to these two areas of guidance that have come out from the federal government. It's all part of something called Executive Order 14043. Here's the bottom line as we sort of merge into our Q&A section with Kirk, which is that there's just so much we don't know still. We do know things are happening, and we do know that there are requirements being placed upon employers that deal with the federal government, certainly, but also employers that have 100 or more employees. And so there are things in motion right now, and very quickly employers are going to be required to comply with these mandates, and we need to know how to do that. Is it going to require hiring another person, bringing them into the workplace to manage all of this for you? Are there programs out there, apps that make it possible to manage every aspect of these mandated tests and mandated vaccinations and the record keeping that's involved in it? We're going to talk about that from a very practical standpoint. So let's start with the sort of a primer on COVID-19 vaccine and testing management. And to get us started, I'm going to bring Kirk into the discussion now. Kirk, welcome to this discussion on a very complex issue. I'm sure everybody on the webinar today is anxious to hear what you have to say about it.
Thank you, Bill. I appreciate being here with you and everyone else, and I look forward to talking more about the subject.
Okay, so from a very practical, basic standpoint, how can an employer manage a program like this? What are their options?
Well, I think the first is, as you said, since there's a lot of unknowns and a lot of different moving parts and information to manage, the number one thing is to get organized. And that can mean a lot of different things to different types of employers, different sizes of companies. A few kind of general methods might be using a paper-based system, kind of the old traditional tried and true paper file system. Some folks still have that today and can be fine in a small, very small organization or company. Another might be to have your own established electronic system, some type of homegrown solution where you incorporate some of your existing technologies and maybe some of your software that you use for other business purposes. Excel files, Word documents, or email communications maybe between you and your staff. And then third, and what I think is the most preferred system or solution would be is an electronic software application that's specifically designed to simplify and automate the program. So that might include things such as managing the vaccine records of the employees who have been vaccinated. And for those who haven't, schedule testing for them. And then most importantly, be able to track if that testing is occurring, when and how it needs to. And then even more importantly than that, the results from those testing, being able to identify quickly any positives that come in so that you can make decisions on who's available to be in the office and who isn't, and just how to keep the office a safe environment. And I think one thing that's really important about the electronic system to also consider is that it has those three interfaces, one being for the employer, whomever on the personnel staff that's going to manage the program using the system. The employees, they need to have a window into this system also to supply their own information, such as their vaccine records or their test results, and also to see their information, their history, so they can have access to that as well. And then, as you mentioned, we aren't fully aware yet what the third-party requirements might be with all of this information that we need to manage. But that would be another interface to consider, is that employers may need to report data to either federal, state governments. Currently, right now, a lot of the testing entities that are testing us today are actually reporting results to state departments of health. But that may be a requirement that the employer has to consider for the future as well. Plus, looking at, as you said, OSHA is really driving a lot of this. We may need to report to them. And I think it's something important to consider too in terms of insurance. We don't know yet, but in the future, there may be insurance benefits or benefits to our insurance coverage that we do have documented and a system that we can show to our carriers what we are doing and what we put in place may help us in the future with our rates. So that's something important to consider as well.
So let's go even more basic now. This information is going to be gathered. There's got to be a way to process the information, to store it, to have it ready to report when required. But since March of last year, we've been hearing about different ways of testing for COVID. And so let's talk about that for a second. And I've got this graphic that I want to put up on the screen that shows the different types of tests. Maybe you can walk us through the basic differences between PCR, antigen, and antibody testing, and whether it's a lab-based test or a rapid test.
Sure. Yes. And part of the management of the system, as we said, and I think the most complex piece is going to be able to manage the testing for those employees that are not vaccinated but need to meet the requirement of a weekly negative test. As you mentioned, there are several types of tests available today. Antibody was actually one of the very first tests that was presented to us, or we saw hit the market when the pandemic really picked up speed. That method is used to just see if you have had the virus at some point or you have the antibodies. It doesn't show you that you're currently with the virus or that you're shedding the virus. So in our future in which we are going to be required to provide weekly testing and negative results, as we were saying, for folks to come into the office, that would not be our preferred method. It wouldn't be appropriate. PCR or antigen testing would be, as those do show if an individual is currently shedding the virus. PCR is typically a lab-based test type where we would provide a specimen. That specimen would be routed to a laboratory and they would run a PCR test against that specimen to see if you have the virus or not. There are rapid options for PCR, not quite as readily available, but they do exist. But in terms of antigen testing, our testing there is most often in a rapid environment. This also would be referred to as point of care testing, where an individual, when they are doing their collection within minutes, would see a test result through a device, a point of care device that would be used. So again, the biggest or the two that we would want to focus on, an employer would want to pay most attention to right now would be PCR antigen. And then the next real decision would be is to determine if you want to use a lab-based test versus a rapid. And probably the most notable between the two, besides the turnaround time, lab-based testing obviously is going to take a little bit longer to retrieve results as it needs to the specimen find its way from the donor, the employee, to the laboratory for analysis. That typically right now is about 24 to 48 hours, where on the flip side, antigen being a point of care test, you can have results often in 15 to 30 minutes. So those would be the two biggest differences.
And there's different specimens that can be collected, right? So maybe you could walk us through, the options there.
Yeah, absolutely. So we mentioned antibody testing as one of the very first tests in the pandemic that surfaced. That typically is done through using blood specimens, a simple finger prick collection method where you take a drop of blood, place that in the device, and that may be also a point of care device that will then, through lateral flow, show you a result in minutes. But in our type of testing that we need to do for the upcoming or current requirements that we're seeing would most often be done either via oral fluid, saliva, or nasal, where there is on the nasal side, that's where a swab of some sort that would be used to swab the inside or the anterior part of a donor's nasal cavity, their nose. And then that could, as we were saying, be used for either an antigen or PCR test. So that could be a point of care type test or a lab-based. But I think in terms of simplicity, whether you're thinking in terms of ease of collection, meaning it's very simple to do, quick to do, very hard to make a mistake, that would be to use a saliva specimen. In that example, the donor, the employee, just simply provides their saliva into a tube. That tube is then capped or sealed. And then depending on the type of test, PCR, most notably, that would be delivered to the laboratory for analysis, and we'd receive our results, like we were saying earlier, in roughly about a 24 to 48 hour time frame.
Now, so employers are hearing this either from their provider or they're reading about it, et cetera. And, you've got the antigen, the PCR, probably not really focusing on antibody testing at this time. And of course, some guidance many months ago now from the EEOC said that antibody testing probably not appropriate under most, or not useful under most workplace situations. I know that I went into the hospital back in June for an emergency appendectomy, and they did all kinds of COVID testing on me. They wanted to know if I was actively infected, if I'd been infected in the past, because that would have a bearing on the type of, how they treated me in the hospital. And one of the things that comes up often, Kirk, as you know, when it comes to drug testing, is the question of whether or not to use a government certified laboratory if you're doing lab testing, or if you're using a collection device that's either going to yield an instant result or is going to capture a sample and send it into a laboratory. The big question that comes up is whether or not you should be using an FDA cleared device. And so FDA clearance or an FDA issued emergency use authorization, that comes into play again with COVID testing, right? Because there are some devices out there that do have some form of FDA authorization and others that are not. So is there sort of an emphasis on using some type of an FDA authorized device or testing method?
Absolutely, that is an absolute must. Any of the collection devices, whether you are using a lab-based collection device for lab-based tests, or you're using a point-of-care test for instant results or immediate results, as you mentioned, those need to absolutely have, at a minimum, the FDA Emergency Use Authorization, the EUA. This would always be displayed on the devices or the device packaging, or with the materials, collection materials, and the details about those devices will be packaged with those. So that's an absolute must that you want to make sure and ensure when you're choosing your test type or your test devices, that is it's included. That also goes a little bit further. If you are using lab-based testing, say the PCR method, you also want to ensure that the laboratory has gone through their proper steps to have their test methodologies also FDA, EUA authorized. And that would be readily available from the laboratory, and some additional information that they will provide you as they can show you their EUA would also be their sensitivity levels and their specificity levels, which essentially, in layman's terms, just means the accuracy of their test methodologies. So of course you want to try to pick a solution that is going to have the highest sensitivity, the highest accuracy, so you're getting the best results and you have the best information to make the decisions that you need to.
Yeah, and I would draw the audience attention to the last bullet, as Kirk was just mentioning, the sensitivity level, which is the chance of a true positive, and a specificity level, which is the chance of a true negative. And so you want to look at the package insert that comes with the testing device to see, what percentage. The higher the percentage, the better. And in the world of drug testing, of course, and a lot of our audience members would be very familiar with the drug testing world, for employers, they want a legally defensible program. So I'm always shocked anytime I hear that there's a company using, say, a rapid result testing device that's not FDA cleared, because the first thing an attorney is going to do when an employee wants to challenge a test result is find out if it was an FDA cleared device or not. And if it wasn't, that creates an opening for the attorney to place some reasonable doubt on the efficacy of the test result. We're not there yet with COVID testing, but it's something employers want to do. You don't have to be an expert on the science behind the test, but you do want to make sure that you're checking certain boxes that assure the utmost legal defensibility of your testing program. And we'll probably get there with COVID testing eventually. And part of the question, I think one of the key questions that's going to come up is, how did the specimen get collected, Kirk? So kind of take us through the options when it comes to the collection of a specimen.
Sure, and I think it's important, as we were saying, of the two different types of tests, from a collection standpoint or a test standpoint, meaning whether that test is a rapid test, a point of care, or a lab-based test. When we are using the specimen types of oral fluid, saliva, or nasal, we do have a couple options, actually I think it's best to say three options in terms of how to get those collections done. And all of these options actually apply to both test types and both specimen types, oral fluid and nasal swabs. The first would be to do an in-person collection. That might be where an employee actually travels to a nearby collection site. A collector at that site performs the collection. They either provide the device if it's saliva, and then the employee provides that saliva into the device. They cap it, seal it, and take care of the rest of the steps. Or if it is a nasal swab, again, the collector can either perform that swab, or with the anterior nasal option, the shallow nasal, the actual employee themselves will swab their nose. The important piece here is that the individual is doing that at a site with guidance or supervision from a collector. A kind of a secondary option with in-person collection would be to have an on-site collector at your workplace, at the employer's workplace, where employees could schedule a day or a time with that collector and do that on site. So they don't necessarily have to travel, but there does need to be a location identified at the workplace for that to occur. Another option would be is self-collect. This is where, as I mentioned, although you may go to a site or have a collector at your workplace, the employee may be doing that collection essentially themselves, but rather than doing it at a site or at the workplace, they could do that at home. So there are many, as you mentioned earlier, devices for self-collection that are FDA EUA. Important thing to make sure that we follow up with and ensure that that's in place before doing any self-collections. Not all devices do have, self-collect devices do have that, but if they do, then it would be very appropriate for the employee to do that collection at home. And then the third, and what I think is probably the most advantageous of all the different types for many different reasons that we can go into, but to do a telehealth collection. This would be a kind of a combination of the first two, where the employee would do a self-collection, but have oversight, but not have to have that oversight with a live person right there next to them. So that collector may be online via a web meeting platform, something similar to like what we're doing today for the webinar, or a technology application specifically designed to guide the employee on how to do the collection, as well as verify that they're doing the collection properly. So those would be the three areas that I would say are the best to focus on when thinking about which is often the most difficult part of the process that we've been talking about, and that's how to collect specimens from your employees. A lot of moving parts there.
And there are things we don't know yet, of course, but let's say that basically going forward, these government mandated vaccinations or tests, weekly tests of those who aren't vaccinated, or any other number of things that may come, into play at some point. Maybe all of that stays in place. It becomes sort of regimented. Employers have to do these things. Maybe employers with fewer than 100 employees decide we want to keep track of these things as well. We've got a lot of employees who travel, or we have people who travel outside the country, things of that nature. So let's say it kind of goes forward and you want to do this and you decide sort of like, be very difficult to do this with a paper system, especially if you have a lot of employees, or if we have people on today's webinar that are drug testing providers, for example, that are trying to figure out how to provide COVID management to their clients to help them manage this program. How do you get started, Kirk? I mean, where does an employer start when it comes to, putting this program together from square one?
Sure. Well, I think as we were saying that, and you mentioned just now as well, the paper system may be okay, a homegrown system maybe a step up, but to identify an electronic system that really is specifically designed for this is in our opinion the best place to get going. And assuming that you've done that and identified that one that works for you, you would actually get that system online, get it started by in I guess the simplest way to say, importing or establishing your employee population into that software, into that electronic system. That way that anybody that's part of your organization, and as you mentioned, another good example, if you are a provider of services such drug and alcohol or COVID testing and wanted to extend an electronic system to your clients, you would begin in the same exact way, establishing the population of all the employees that need to be managed for the COVID vaccine and testing program. Next step really would be is to use that system to develop and or to kind of put everyone into one of two groups. Those would be the employees that may not be subject to weekly testing. Maybe those are individuals that are 100% remote or work from home. And I think what would be most important to also make sure with those individuals is that they don't travel. They may be working from home, not in the office, but if they are traveling and visiting customers or prospects, if they're in a sales environment, for example, they still more than likely would need to be part of the program in terms of providing vaccine records or a weekly test before they could make those travel arrangements. And then it's everyone else, and everyone else who is coming into the office or regularly on travel. They would then be divided into two more groups, those that are vaccinated and those that are not vaccinated. For the vaccinated, in all intents and purposes, from what we believe, a lot of the guidelines that we've seen so far, what we think they're going to look like in the future, it probably may not need much more interaction with those individuals unless symptoms do occur with them, COVID symptoms occur. For those that are not vaccinated, I think the two things next that we are going to be needing to look at would be is periodic health screening, and also then most importantly, their weekly testing before they would be allowed to come into the office or to travel for other work requirements.
So I just want to point out one thing. I did a webinar maybe just 2 weeks ago on how to maintain a drug testing program in a world of remote workers. And it's an interesting issue because more people are working from home. Many companies that had virtually no at-home workers before the pandemic have almost completely converted to a virtual workplace. And so when it comes to these COVID testing or COVID vaccination requirements, I guess one of the questions, Kirk, that we maybe don't know the answer to yet is whether or not some of these requirements will apply to remote workers.
Absolutely, and I think that's where probably a very good idea to consider with an electronic system also is to think about health screening, not just for those that you know do come into the office or go on travel, but for even those that may be working 100% remote. The health screening definitely would give you a potential window into risks that some employees may have in terms of exposure with other individuals that have contracted COVID. So it could allow them to maybe test more quickly, get results more rapidly so that you know whether or not they can be coming into the office if special situations occur or if travel does need to come up. But even also important would be for those that are coming into the office, just the regular health screening would be important in addition to their weekly testing. And that could all be facilitated through the electronic system, automated, and allow you to have that data in one location so that you can report and track that as it's happening.
Okay, so let's turn our attention then to the tracking process. So let's first talk about the health screen tracking.
Sure. So in a lot of the electronic systems today, they will have the CDC recommended screening, or the pre-screening, I should say, that has been provided to us for quite a long time back from when the pandemic started. This just included many different questions in terms of what might identify someone's exposure, whether they had been with someone who believed to or had tested positive, or if they may have traveled and just put themselves in a situation where exposure could have been possible. Again, it was previously recommended or has been recommended by the CDC. We don't know if that would be part of the soon to be published federal guidelines, but it is definitely a proactive decision that I think would be wise to make. Again, as we said earlier, it might just help us test someone out of schedule so that we could just identify a potential risk sooner. May help us understand and know that we need to limit access to the office. And then something that I think has been happening on a larger scale, not so much with employers themselves, but it would allow you to do your own internal contact tracing, which could also help identify risks and mitigate those risks and help reduce the spread if you do have positive cases in your offices. So again, we don't know yet whether or not this may be part of the requirements, but we think this is something very good to consider. And with an electronic system, facilitating that is going to be much more easy to manage in previous ways.
Okay, and what about vaccination tracking?
So one of the probably the simplest part, at least in terms of the multiple steps that are required for it, with using an electronic system and meeting the requirements of a COVID management program, is going to be able to receive vaccination records from employees. And an electronic system, hands down, is going to help you do that. You would be able to have your employees upload vaccine records. That would include the information on their first shot, their second, and then now that we know boosters are being approved, to be able to provide that information plus other details in terms of the brand of the vaccine, maybe even something like the lot number that was assigned to that vaccine when it was provided. It's important to note that there isn't a central database right now in terms of being able to query to see if someone says they are vaccinated, to be able to go and prove that, if you will. But by utilizing an electronic system, you could also have the employees upload photos of their CDC vaccine cards, and then also incorporate some type of ID verification or document validation process. Basically your own checks and balances to do as much as you can to ensure that the vaccine records employees are providing to you are real and in fact valid. The biggest advantage here, of course, is of being able to quickly track who has the vaccination and who hasn't. We talked about that earlier in terms of being able to identify your two groups of employees. Vaccinated don't need to test weekly, or those that are not, so you'll know right away who does need to test weekly. And I think the other big thing here with some of the electronic systems to consider is having a mobile pass to be able to give the employee a quick and easy way to display or demonstrate that they do have a vaccine on file. You may have a facility large enough that in order to gain entry, you either would want at that point of entry someone to be able to query the database, the electronic system, to ensure that there is a vaccine on record for that employee, but even quicker and easier would be as a digital pass of sorts, which we have some examples in terms of what you see on the slide here. That would make that just very quick and easy for both the employee and the employer to communicate that.
So who in a company would typically have access to this tracking information?
So in most situations, the employer would identify where the management is going to be centralized from the employer angle. I think most often we see that with HR, human resource departments. And then in addition to them needing to manage it, have access to it, report on it, verify the data, and so forth, it's also important, as we were saying, for the employee to have access as well. That may be for the employee to upload their own data and or to see the data that has been captured for them on their in their file, if you will. So I think it's important that both sides of the employer-employee relationship have access to it.
So if you're a company with several hundred employees or thousands, and just using the national average of the percentage of individuals, adults who are not vaccinated, it could be a lot of people being required to be tested on a weekly basis. And so it would just seem like a massive undertaking to track the results from these tests on an ongoing basis.
Absolutely, and as we said earlier, the different types of testing that's available and the ways of getting that testing and the collections done really complicates that as well. So of course the electronic system needs to include a way to track your test results or store your test results. When using a lab-based test, a PCR test, and working with a laboratory to conduct those test analysis and receive those test results, there's often going to be an integration available. And so having an electronic system that is integrated with your laboratory to receive those results in real time will speed up the process, increase the accuracy of the results, and just make those quickly available, as we were saying earlier, to both the employer and the employee, who often is going to want to know themselves, of course, when testing, whether or not they're positive or not. It's important to them just from the work side angle, but also personal and for being at home with friends and family. If we are incorporating a test program that's point of care or other methods where the employee may be getting tests done on their own, then the electronic system needs a method for allowing that individual, the employee, to be able to upload those results. So uploading the actual lab result as an electronic document maybe in the rapid or point of care environment, the employee could take photos of that test kit as the results show up, like we were saying, in a short period of time, usually 15 to 30 minutes, in addition to just uploading and entering the positive or negative result from the device. It would be a good idea for them to also be able to upload a photo of that as backup or as documentation that goes along with that result status. I think the most important piece when you do have a system where an employee is doing their own testing and uploading their own results, it's not a lab-based method where those are coming direct from the lab, is to incorporate some type of ID verification and document validation process. So having the electronic system actually allow the individual to provide the data necessary to understand that it is really that employee who's uploading the records, and it was them who provided the specimen for that test result is very important, just like it is in other types of testing that we do, and as you've talked about before, such as drug and alcohol. Same thing as before, in terms of the vaccine records, it'd be very important for the electronic system and to the employee for them to be able to display and have access to their own results, whether that's through the portal or through a mobile pass. Same that we had on the previous slide with some graphics here. Some of the digital health passes available can make it very quickly and easy for an employee to demonstrate at a port of entry to, say, a workplace environment, their most recent test results. So that just speeds up the process and gives them access also, as we said, to their test history.
And all of this, I've got to imagine that the people on today's webinar are just, thinking of all the moving parts and trying to keep this straight and keep up with the requirements on a week-to-week basis, being especially with, companies with more than 100 employees and how complicated that can be. And so as Kirk and I were going through the slides, just an hour ago as we were preparing, one of the slides that stood out the most to me is this next slide on reports in real time and alerts and notifications, because I was just thinking, if just like anybody else, it would be so challenging to keep up with this, that if I had some kind of a system that was, giving me alerts so that I could respond to that instead of trying to always keep up with it on my own or proactively. And maybe you could address that issue, Kirk.
Absolutely. With everything we talked about earlier, it's all about gathering data and pulling the data together once all the different events occur, uploading vaccine records, verifying their authenticity, having a test conducted and results received. It's great to have all that data, but not being able to report on it and act on it would not be very helpful. So of course, with an electronic system, absolutely you would want and need to be able to, through that system, establish some alerts, real-time alerts to identify non-compliant events for you so you can react to those quickly. Maybe employees aren't uploading vaccine records by an agreed upon date that you established, or not getting a collection done or a test received from a laboratory or through a point of care device when you need it, say Sunday night before you want everyone to be able to show up Monday morning for work. And having scheduled reports to just give you your time and your history of your activities. Obviously that helps you make decisions for the current environment, but also for the future. So just monitoring your progress and your compliancy with what guidelines are going to be in front of us. This electronic system, of course, that's really where the power comes out. I think it's important to note too that with all the information, it can help you to project what your needs are in the future. So if you are ordering testing supplies or scheduling collection events, the system is going to allow you and help you do that. And as we mentioned before, a lot of this information and the reporting is for you, the employer, or for you, the provider that works with various employers to provide services to. But it also may be, as we said, a requirement for the employer to report their data to outside or third-party sources. So having it all in a central location, easily accessible and distributable electronically, obviously it's the easiest to distribute, is another big, huge advantage and reason for having the system online.
So as many people in our audience know, here at the Current Consulting Group, we do a couple of different surveys every year. We've been doing them for the industry survey. We've been doing, this is our 23rd year. And so we've been gathering information on different trends in drug testing. And prior to 2020, telehealth collections never came up. It never got mentioned. And I know that's not a surprise to anybody, but as COVID hit and people were forced to work from home, then telehealth collections became something. And we did a mid-year and an end of the year survey in 2020. So we actually ended up doing 3 surveys last year. And by the mid-year survey and by the end of the year survey, we saw significant movement in the area of telehealth collections. Now, of course, we were asking about drug testing, but certainly would be applicable to COVID testing as well, right? Because if you're trying to clear somebody to come into the workplace and they're actually infected, it would be better to learn about that before they come into the workplace and infect other people, so they could do that test from home with the telehealth collection device. And so as we sort of think about that in the context of the evolution of drug testing that sped up considerably in 2020 and has continued into 2021, let's talk about managing the program with an app like Proof. Now, to the audience, I'll just say we're starting our descent. We're getting close to coming down and landing the plane, but these next 3 or 4 slides I think are critical. So Kirk, let's talk first about how Proof works. Proof is one of many different platforms, or probably not many, but of a number of different platforms that are out there. But I like the fact that Kirk had the foresight before COVID, of course, to be thinking of this in terms of helping employers deal with drug testing collections. And it just turned out to be almost prophetic when COVID hit, that we needed some other way to collect specimens for the significant percentage of the workforce that was now working from home. So how does Proof work?
Well, Proof, as you mentioned, Bill, we did start working on this solution, a tech solution, actually several years prior to the pandemic, and it was to address specifically, as you mentioned, the difficulty with specimen collections for those test types, drug and alcohol. But Proof has actually, over the last year and a half, evolved to be much more than that, not just for a collection platform for drug and alcohol testing, but a collection platform for COVID testing. And then even more importantly, for a platform to manage a COVID testing program and everything that involves that. As we mentioned earlier, something such as managing and tracking vaccine records, managing testing schedules, actually performing the testing process itself, which includes being able to do remote at-home specimen collections. And so Proof is essentially a cloud-based compliance system, a HIPAA compliant system, excuse me, that as we've been talking, we know and understand now that is the best in terms of automating and simplifying what the requirements are and what we know and expect them to be with employers who need to have their employees either supply their vaccine information or adhere to a weekly testing program. So Proof starts, just like we mentioned before, as being one of the best or the best place to start by establishing and managing your employee population. Helps you figure out between your employees, those that are vaccinated, those that are not, so that you know and can identify who needs to test. If utilizing Proof for your collections and your testing solution, in addition to your information management solution, you can actually order your tests through the platform. So you can not just get all your information managed, but you can actually facilitate the whole testing program as well through the platform. So with all that, like we said, of course, doing all the data capture, all the testing, being able to track an employee's compliancy and their results. Proof gives you the ability to determine who in your population can come to the office if someone does test positive, or if using the pre-screen questionnaire that is also built into the Proof application, who may need to quarantine or who may need to test out of schedule. But I think, as you mentioned, the most kind of differentiator with Proof, and if there are other electronic systems out there to help manage a COVID program, the number one feature that Proof has, and the greatest differentiator, is that it allows you and your employee population to do at-home collections, keeping them safe out of the office, testing when it's most convenient for them. Disrupting work, I think, is a real, not disrupting work, I should say, is also one of the primary advantages. And at the end of the day, it also helps reduce costs. Live collections or on-site collections are very expensive. And as we mentioned, of course, in this environment, you want to be as safe and secure, which means not having as many individuals around you as possible. So being able to do collections on your own in your own private environment, such as your home, prior to coming into work, having that information available earlier than later, those are all the greatest advantages, and how Proof provides a good management system for what we've been talking today in terms of the guidelines around COVID vaccine and testing.
So let's talk specifically about the telehealth collection process, and then how it specifically works on the next slide.
Sure. So we did mention telehealth, and to be fair, there are a couple different ways in which a telehealth collection can occur. One is where a donor or a collector, they're in two different locations, very similar to what we're doing today, but yet instead of seeing slides, we would see one another. So a live collector on the other end of a call like we're doing now would walk me through the steps of how to do my collection, assuming I have all my collection supplies in hand. On the flip side, and the way that Proof works, it's 100% donor driven. So Proof as an application provides the donor, the employee, all of the steps that they need to go through to get a collection done safely, securely, accurately, and at the same time verifies their identity. And the best part of this is that the scheduling required is only for the employee. No other live collector needs to be scheduled. Proof is open 24/7. So that means that the donor can do this when it's most convenient for them, end of the day, early morning, whatever, whenever they have the time to be able to do it. So those are a couple of the two different options and the differences. But Proof specifically with COVID-19, I think, as we've said, which is different from other types of specimen collections, let's say for drug and alcohol. One of the greatest advantages is that the employee is safe and out of harm's way. So they're not in an office doing a collection. They're not at a facility doing a collection. They are essentially quarantined while they're doing their collection and waiting for their results. So they're in the safest space that they could be. The application also, by the way, does allow the individual employee to upload their vaccine records through the mobile app. So that they can do that on their own. The employer doesn't have to go through a series of requests and communications with the individual, gathering the data themselves in terms of the vaccine records. That can all be done proactively by the employee. So I think in terms of the telehealth collections, Proof definitely has a lot of its advantages over others. And is, as we mentioned, safest and most secure and most convenient compared to those that are out there.
Yeah, I was just going to mention, Kirk, as we sort of get close to the top of the hour, if you could take us through just briefly how it works, but I want to get to this next slide before we close.
Sure. The real simple, we're under the assumption everybody is already in the system and the schedules are really established. The employees that need to test, we know who they are. Of course, as an employer, we have their addresses where they need or would be testing from. They would receive their supplies via carriers such as FedEx. When it's time to test, let's say the employer-employee agree that a Saturday or Sunday test needs to occur, so they have results for Monday morning. They would start their application. The Proof app would guide them from step 1 to 15, or whatever the exact number of steps are. That goes from opening up the packaging of all the supplies, providing their ID card so that their identity can be verified, and actually guides them on screen through every step while it's recording that process for accuracy and validation. And then when those steps are completed, all of that information is uploaded to the Proof COVID management system, of which in real time the employer knows that you completed your collection. Your results will then be married up as they become available, whether it's a rapid device and they upload 15 to 30 minutes later, or whether they come automatically through an integration with the laboratory within 24 hours or so. So fairly simple, fairly quick.
Now, Kirk, and just so we don't run out of time, Kirk has a special free offer coming up here in another slide or two. And I know everybody likes free stuff, so we'll get to that in just 1 minute.
Sure. I think we kind of hit on most of these. Of course, the biggest advantage is Proof being just simple and safe, very easy for the individual employee to do. It is important to note it's secure in that the employee's identity is verified, so we know we are receiving a specimen and a test from who we intend it to be. Proof is accurate in terms of the collection process, and the steps are delivered the same way every time. So different from a live collector where we may have someone do a collection differently from time to time, or mistakenly include or not include steps that they should or shouldn't. The application and the process is very accurate. And then, as we mentioned earlier, just being able to report and share the data, it facilitates that by nature of being a mobile technology.
So here we get to how to get Proof.
Yep. So as we said, I think in terms of what said earlier, what's the next step and how to get it, again, deciding which program is right for you, paper-based, develop your own internal, or use an automated system such as Proof. It's really to pick one of those. And I think we believe and hope that number 3 would be what most individuals and employers are going to do. And so for anybody that would like to take us up on the offer, we would like to extend a free access for an employer, one user that they could designate to have access to the Proof management portal. And then we would suggest identifying 2 employees that could have access, maybe one that has been vaccinated and could utilize the features to upload their vaccine records, and then the other employee may be someone who is not vaccinated, so that they could utilize the collection and the test portion of Proof and demonstrate how that works for the employer.
So we'll send out information in the follow-up to all the attendees. You'll get information about this, but if you want to contact Kirk directly, they can simply call you, right, Kirk?
Absolutely. Our information is here, and as you said, the slides will be available to everyone, but they could call me directly. That is my direct number that you see at the bottom there, and that's my direct email too, of course. So love to hear from anybody that would like to know more information or take us up on the offer to let them have access to the Proof platform.
Okay, well, thank you very much, Kirk. Excellent information. And let me just turn it over to Jessica to tell our attendees today how they can get the slides.
Great. Thank you so much, Bill and Kirk, for that valuable information and for walking us through those slides today. We'd like to thank all of you for joining us today, and we hope that you found today's presentation informative and helpful. This presentation was recorded, and we will be emailing you instructions on how to access the recording. If you have any questions for today's presenters that you think of after today's meeting, please feel free to submit those questions now in the Q&A, or as we mentioned just now, that you can reach out to Kirk directly to learn more about the Proof system and how that can work for you. And with that, we'd like to conclude today's presentation, and thank you for your attendance. Have a great day.